Well, hello everyone. Good morning, good afternoon, or good evening. It all depends on where you're joining us from. It's truly a pleasure to have you all here today. I just want to make sure that you guys get to hear me. Is it my sound okay?
Yes.
Okay, great. Thank you so much for confirming. So, as people are still joining, I'd love to take a moment to welcome you and also recognize that we're having an incredible global audience. And we know that participants are joining from different regions around the world, and that reflects something very powerful. It means that oral health is a topic that somehow connects all of us, no matter where we are. My name is Mónica Domínguez, and I serve as the director of the oral health programs at the Small Train, and it is an honor to be here with you today, since we are doing all these celebrations around the World Oral Health Day. So to get this started, I would like to share that World Oral Health Day, which is led by the FDI, the World Dental Federation, was created to raise global awareness about the importance of oral health and its connection to overall well-being. Over the years, it has grown into a global movement. It's bringing together communities, health professionals, organizations like us, and advocates to highlight a simple but very powerful message that oral health is essential to health. And this year's theme, which is a happy mouth is a happy life, really captures that idea beautifully. Because when we think about it, oral health is not just about teeth. It's about being able to eat, to being able to speak, to smile, to learn, and to actually live with confidence. So at the Small Train, we're especially excited to see how oral health is gaining more attention globally because for a long time, it's kind of like being a little overlooked, particularly in the context of comprehensive cleft care. But this is starting to change. And that shift represents a huge opportunity an opportunity to prevent disease, to reduce the burden of care, and ultimately to improve the quality of life of our patients and the families that we serve. So, today we're really excited to bring together an incredible group of experts and advocates who are going to help us explore this topic from different perspectives. So, first, please help me welcome Dr. Vika Lucy Krebs, a pediatric and craniofacial dentist. She's clinician scientist whose work bridges oral health, cleft care, and a person-centered healthcare, drawing on both professional expertise and lived experience in cleft. She advances equitable care for children and young people with visible differences and is committed to partnering with families and empowering children. She will share some insights on the role of oral health in comprehensive cleft care and how supporting families can really improve outcomes worldwide. Next, it is a pleasure to introduce Dr. Daisy Masis, a small train partner, a really close friend of all of us. And she is a pediatric dentist whose work is guided by both professional commitment and also a genuine sense of purpose. As a global oral health advisor, she's been supporting healthing with children with cleft lip and palate, and she also focuses on improving care, education, and access for our community. Her approach to dentistry goes beyond the clinical setting, reflecting a strong dedication and making a meaningful impact in the lives of children with cleft lip and palate. And finally, we have Dr. Professor Brady Mossey. He is a member of our Small Train Medical Advisory Board, and he's a global leader in craniofacial anomalies and oral health research. His work focuses on understanding the worldwide burden of cleft and advancing evidence-based, equitable care. He has helped shape global approaches to cleft care, oral health guidelines, and training for providers and families, and he is going to share with us his insights on improving care for children everywhere. With that, I would like to invite Dr. Vika to please share your screen, and you can open your microphone. You know, the floor is yours. I just want to remind you, all of you, to please, like, if you have any question or comments, you can just put it in the chat, or there's also a Q&A chat that you can drop your questions there. So, Dr. Vika?
Hi, everyone. I hope you all can hear me. Um, Thank you so much for the kind introduction, Monica. And thank you so much for hosting this important webinar. I feel oral health is always one of the last things people think about in cleft care. But the fact that you're hosting it and making it accessible through a webinar for people in low resource settings everywhere in the world is a big deal. And creating this with Smile Train, actually showing what comprehensive cleft care is even bigger for me and something very close to my heart. As many people know, my journey with cleft care did not begin in a clinic. It began as a child, growing up with a bilateral cleft lip and palate myself. So today, I speak to you not only as a clinician and researcher, but also as someone who has a lived journey of cleft lip and palate. And one thing I always add on is every journey is different, every experience is different, but there's so much to learn from all those different experiences. And having that both experience, clinical, but also the lived one, that perspective has also shaped how I understand care. Because cleft care is not only clinical, it is lived, it is relational, and it unfolds over time. And if we truly want to improve outcomes, we must start looking beyond procedures. And when we think about cleft care globally, especially in low and middle income countries, we often focus on access to surgery. And organizations like Smile Train have transformed that access. But surgery is only one moment in a lifelong journey, because what happens before, between, and after surgery is just as important. And this is where oral health comes in. Not as an add-on, not as a luxury, but as a foundation. Globally, oral diseases affect around 3.5 billion people. They are among the most common health conditions we face. And the most common of all is tooth decay. So when we talk about oral health, we're talking about something fundamental. And for children born with cleft, this matters even more, because oral health influences speech, feeding, surgical outcomes, and long-term well-being. It also affects something we don't always measure: how a child shows up in the world. Because teeth are visible, a smile is visible. And the smile is not just biological, it is social, it is identity, and it is confidence. It is a form of nonverbal communication. And when oral health is compromised, that communication is affected too. And if we want to move cleft care forwards globally, we need a shift from intervention to prevention, from treatment to foundation, from access to continuity. And this shift rests in four simple principles, four powerful ideas: prevention, partnership, voice, and education. Prevention is where impact begins, because oral diseases are largely preventable, and yet they still affect the most vulnerable children the most, especially in low resource settings. Prevention is not complex. It is daily: brushing, fluoride, nutrition, small habits repeated over time. But those small habits shape entire futures. So we have World Oral Health Day tomorrow, but every day is Oral Health Day. And our second pillar is partnership, because care does not happen in clinics alone. It happens in homes. Families are not bystanders, they are essential partners. But partnership requires more than giving instructions. It requires understanding. And that means not just communication, but active listening. Because families face real barriers: access, costs, health literacy, cultural context. And unless we understand these, we cannot create care that truly works. Our third pillar is voice. Children with cleft spend years in healthcare systems, but too often they are treated as passive recipients. And yet, they are experts in their own experience. When we listen to children, care becomes more human, more relevant, more effective, because person-centered care means the person comes first, always. Sorry. And this is where everything comes together with education, because many of the challenges we see in cleft care globally are not only about access, they are about understanding what a cleft is, understanding what oral health means, understanding why oral health matters from the very beginning. We need to educate parents so they feel comfortable, they're not overwhelmed, they don't feel any guilt. We need to educate children so they grow up in their own care, confident, and are able to feel a fully happy life, having a job, having a relationship. Everything should be possible. But we also need to educate ourselves. We need to listen to the families. We need to listen to the children as professionals. So we truly meet people where they are. Because when people understand, they act, they engage, they take ownership. And that is where real change can happen. Education is not just information. It is empowerment. It is what makes prevention possible. It is what makes partnership real. It is what gives voice meaning. So on this webinar for World Oral Health Day, we are reminded of something very simple, but deeply important. A healthy mouth is not a luxury. It is the foundation for life. A healthy mouth has so much impact on all of the care they need and just on the daily things in life. In cleft care, it is a foundation we must build from the very beginning. Because success should not be measured only by the surgeries we perform, but by the lives children are able to live. The confidence they carry, the voices they use, the smiles they share, and the futures we help shape. I could go on, but I will stop now. Thank you so much for inviting me, and I'm looking forward to hearing all the other wonderful speakers that we have, who have so much more to share, and also to the Q&A questions. Thank you.
Thank you so much, Dr. Vika. Such a powerful and important perspective. I really appreciate how you highlighted not only the clinical aspects of oral health in cleft care, but also the human side. You know, the impact on confidence, on well-being, and the importance of truly listening to children and families. So I would just like to build on that. At the Smile Train, we see oral health as a fundamental part of comprehensive cleft care. But the reality is that for a long time, oral health has been approached in a very limited way. It has often been as something we address only when the disease appears. You know, when there is pain, when there are cavities, when treatment is needed. And in the context of cleft care, this becomes even more complex because, as we know, many aspects of cleft treatment are not preventable. We cannot prevent a primary cleft lip surgery. We cannot prevent the need for orthodontics or speech therapy. But oral disease, that is something we can actually prevent. And yet today, it remains one of the most common challenges we see in our population. So when oral health is not addressed early, the impact goes far beyond the mouth. It means that it's more pain for the child, more stress for the families, delays on treatments, increases costs, and this is a heavier burden of care through the entire cleft journey. So when we think about it, oral health is one of the few areas we have actually a real opportunity to change the entire experience of cleft children. And this is where we believe the paradigm shift that you mentioned is needed. We need to move from a model that is focused on treating disease to one that is centered on preventing it. Because prevention is not just more effective, it's more humane, it's more sustainable, and it has the potential to actually transform lives. But this shift to happen, we also need to have a cultural change. And with that, we need to start recognizing that education is intervention, that guidance is treatment, and that supporting families is also care. Because sometimes the most powerful thing we can do is just help a caregiver understand how to prevent disease before it starts. So at the Small Train, our vision on oral health is very clear. We want to move toward a future where our children, our cleft lip and palate children, are not just treated, but that they can grow up free from a preventable disease. So a place where we can actually reduce unnecessary pain, where we can reduce complications, and ultimately we can improve quality of life, not just for our patients, for the families also, the families that we serve. So, and this is exactly why we developed the Small Train Oral Health Through Prevention program. We call it the STOP. The STOP is about one simple idea: prevent the preventable. And it is about integrating oral health into cleft care from the very beginning, not as an add-on, but also as a fundamental component of care. And it focuses on early intervention, on preventative care, and education for families, and also for empowering not only the oral health providers, but the entire team. Everyone needs to be involved and engaged. Because prevention does not happen in the clinic alone, as you said, Dr. Vika. It happens every day. It happens at home. It happens in the hands of the caregivers and the habits that we can build with them over time. And of course, for this vision to become a reality, we need to make prevention practical. We need to make it accessible. We need to make it scalable. So we need to give providers, families, and communities the actual tools that they need to act. So that is exactly what we're being working on, and developing resources that translate this vision into simple, actionable steps. So with that, I am really pleased to pass it to Dr. Daisy Masis, who will walk us through the STOP toolkit and share how these resources have been used in different partner centers to support providers and families around the world. So Dr. Daisy.
Thank you, Mónica. Hello, everybody. Hello, and thank you for that beautiful and wonderful introduction and that clear message about what STOP is about. It's a pleasure for me today to be here with you, celebrating World Oral Health Day. Today, in this presentation, I would like to share with all of you how small prevention actions can really change lives, especially in our children with cleft lip and palate. Because every smile matters and every action counts. Everybody knows that our cleft lip and palate patients face unique challenges, and if they don't have the proper care, oral health disease can pose a significant burden. That is why I am very happy today to introduce the STOP Toolkit, Small Train Oral Health Through Prevention. This is a set of educational, awareness, and practical resources designed to improve oral health, and it's also divided in two main groups. First of all, we can find resources for partners and healthcare professionals. And we also can find resources for parents, caregivers, and patients. This will allow us to address oral health from both clinical and community perspectives. The first tool I want to mention and I want to introduce is the oral hygiene poster. This visually explains proper brushing, making it easier for patients and family to understand and apply at home. It's incredible how the simple tools like this can significantly change habits. Then I would like to introduce the lift the lip technique. This is one of the most important techniques that we have. It's a non-invasive, it's simple, and it can be performed by anyone. The goal here is to address teeth and identify the front teeth and identify any signs of caries. It allows early detection of white, brown, black spots, advanced decay or broken teeth, bleeding gums, abnormal tooth shapes or surface, dental plaque, and abnormal movement of the lip. I love this technique because with this tool, it empowers family to become active participants in prevention. We also have, this is the, this technique, it can be adapted according to the age of the patient. But the key idea here is simple. Look, identify, and act early. So prevention is not only the responsibility of a dental team, it's a team effort. Everybody in the team plays a role in oral health. Parents and caregivers are part of the team. The most important or powerful message here is that everyone can lift the lip. These are the MAC charts, and it's designed to educate parents, caregivers, and primary health care providers. It's a collage of pictures organized by incisors and canines, providing a clear and practical visual aid. It is used to encourage patients to understand the diagnosis of ECC. Another key component for Small Train is training. That is why FDI and Small Train joined together to create the MOOCs. These are the massive open online courses. This is a 3-hour online course, and it's designed for dental health professionals to enhance their knowledge and skills in prevention, diagnosis, and referral systems. We also have included educational videos. In collaboration with FDI, 6 oral health videos were developed in more than 70 countries and translated in many languages. This makes information accessible to families, and it's simple in an engaging way. Parents, caregivers, and patients can watch the videos in the dental office while waiting for their appointments. So it turns waiting time into an opportunity for learning. If we want to talk a little bit about the resource for parents, caregivers, and patients, we can mention this first tool that is my stop calendar. This simple tool helps motivate children and families and encourages lifelong healthy oral hygiene habits. It's a practical tool designed to help patients maintain a consistent oral health routine and good hygiene practices. So families are encouraged to print a stop calendar and record daily toothbrushing moments. The goal is to track at least 2 brushing sessions per day. And at the end of the month, patients bring their complete calendar to the center and can be recognized as an oral health champions. We also have this other resource or tool that is the Small Train Oral Health Passport. This serves as a guide and record keeper for everything related to the child's dental care. It includes a checklist of essential oral health needs and helpful reminders to track dental visits and treatments. The passport helps parents stay organized and monitor dental care over time. It also empowers families in making informed decisions and take control on their child's oral health journey. So on the World Oral Health Day, we are reminded that prevention is not just a strategy, it's a responsibility. Education is not optional, it's essential. And that every smile we protect is a life we improve. So let's continue changing the world one smile at a time. Thank you.
Thank you so much, Dr. Daisy. This was amazing. For sure, the STOP toolkit has been widely used, and we see it being put into practice not only for the oral health professionals, but I love seeing sometimes like the surgeons, like using the charts, getting to refer the patients, at least like to get familiar on what a early cavity looks like, and they can just like refer the patients to the rest of the team. So this is incredible, and we will be sharing also for those who couldn't get the QR code on the presentation. We're going to share the links here on the chat. So, Dr. Peter Mossey, please unmute yourself. We would love to hear from you.
Thank you very much, Monica, for the beautiful introduction of everyone, and greetings to all of you who have joined from all the time zones in different parts of the world. So impressive to see. And actually, the very fact that we're here providing a webinar on oral health and cleft lip and palate on World Oral Health Day is a key statement. It shows how committed we are to action for a condition that's of global significance, and I'll be elaborating on that a little bit, and also being driven by an organization who's totally committed to making the world a better place. So I would like to just complement what was said before with a few observations on aspects that I said I would deal with on epidemiology, quality of care, prevention from a global perspective. And there's three agendas here really in fundamental agendas. The inequalities agenda is one, the quality of care agenda, and primary prevention. And all are underpinned in many ways by epidemiology and by research. So the first thing that I'm really keen to say is that inequalities remains one of the major aspects and challenges of health overall in the 21st century. And a significant driver is the collection of information and data. And birth defects registration in low to middle income countries remains a very significant issue. The problem is if data is not collected, the problem is not actioned. And it's often referred to in global health as the scandal of invisibility. We don't see, therefore we don't act. And we know there's a variation in cleft prevalence around the world. That's a well-known fact, and there's geographic and ethnic variation. But that's driven by gene pools and is largely unavoidable. However, variation in mortality and morbidity and prevention are all things that we can deal with. There's one marker that we have through SmileTrain addressed recently, and that is the age at the time of surgery. And through targeted studies in Indonesia and in Ethiopia, we have now, using SmileTrain data, got really good information on problems in terms of residual inequalities and access to care. And this is an ongoing contemporary challenge to set up good quality, government-supported birth defect surveillance systems so that we've got good ascertainment and we know the extent of the problem of clefts around the world. The areas where we're now focusing on are areas in Southeast Asia, such as Indonesia, in South Asia, and that includes India, Bangladesh, Nepal, and Sub-Saharan Africa. So these are the areas where we really need to set up government-supported birth defects registration systems. The second is the quality of care issue. And I've often said in context of research, there's just two major issues in clefts. The first is how can we optimize the quality of care for those that are born with cleft lip and palate? And the second is what can we offer in the context of prevention? And primary prevention comes in many forms. So the one that's most relevant to the context of this conversation is prevention of oral diseases in clefts. And a huge proportion of the time and effort and expenditure in Smile Train goes into quality of care for comprehensive cleft care, multidisciplinary treatment, but including oral health as now a major pillar. And we want to make sure that the inequalities that have existed in the field of clefts in terms of access to care, quality of care, and prevention are completely eradicate the inequalities. The same quality of care is delivered all over the world. In terms of primary prevention, when we ask the question about why should caries prevalence be elevated in children born with clefts compared to age-matched non-cleft children, we did a systematic review on this and we found that, sure enough, it is a feature all over the world. And there's various hypotheses and explanations of why that might be, some of which are less convincing than others. But one aspect that we've discovered within the UK system, and it probably applies globally, is the very significant issues of cleft lip and palate not being dealt with in our primary care system. There's a general perception among dentists that because of the tertiary multidisciplinary care that accompanies the primary surgical repair, that their dental care is also being catered for through the tertiary systems. However, this is very often not the case and leaves the children with cleft lip and palate at a disadvantage. Obviously, the surgical repair of the cleft, the speech and language therapy, the psychological support, and ENT are major issues at that time. But we find that the cleft oral health care is not being dealt with as a primary priority. And that's one of the major issues that has arisen in the UK. It's been raised at a national level by the Cleft Lip and Palate Association. And just to add that in Scotland, we have a pediatric caries prevention programme called Child Smile. This is Scottish government supported, and it specifically targets those in greatest need. So areas of multiple deprivation. But what we decided is to set up a pilot project to bring Child Smile into the families of those children that are born with cleft lip and palate. And this aligns to the basic principle of proportionate universalism, where the greatest need, those in greatest need, are prioritized. And I feel that schemes like this should be rolled out nationally and internationally. And this would help and complement the Smile Train efforts that we've just seen that have been presented by Daisy and advocated by Mónica. So these are the aspects that with ongoing cleft care, comprehensive cleft care treatment prevention is primary. I'm going to finish off with the aspects that in the global context I feel are extremely important, because we're incredibly fortunate how the global evolution of oral health in the context of overall health has impacted on the visibility of cleft lip and palate. And what I'm talking about here is the World Health Assembly in May 2021, where member states affirmed their commitment to oral health by approving a WHO resolution that suggested that oral health should be added to non-communicable diseases. Now, from that perspective, the WHO Director General, Dr. Tedros, described it as a landmark resolution, and he congratulated Sri Lanka for their work on pushing the resolution forward. And that's significant because the Sri Lankan resolution included a specific mention of cleft lip and palate. And then when the Global Oral Health WHO guidelines were produced, in the introductory statement, it said that oral diseases which have the highest public health relevance include cleft lip and palate, and that many of these are preventable. So we are part of this global movement now. And the real significance is that we're alongside the major non-communicable diseases such as cardiovascular disease, diabetes, cancers and respiratory disorders. And in fact, mental health has been added recently. And that's all part of the Non-Communicable Diseases Alliance. And the way that SmileTrain have adopted this, FDI have adopted this via this oral health and cleft care, comprehensive cleft care project. So I feel that we are in an unprecedented position to be able to influence the global agenda and to maximize the opportunities to make clefts a major issue as we go forward. So I'll finish there and invite discussion and questions.
Thank you so
Thanks.
much, Dr. Mossey. Yeah, this was wonderful. It's beautiful just to see the global approach, how we are starting to talk about oral health, all these efforts done with the report that was done, that we identified that half of the population in the world actually are affected by oral diseases. And then, how the FDI, the WHA, we have been doing the incredible and important efforts towards doing a resolution, doing an action plan, and now translating into actionable things. So thank you so much, Dr. Mossey, for this beautiful perspective. And I don't know, like now it's a good moment to start doing some discussions. Please, if you have any questions, just put in the chat. Dr. Vika, is there anything that you would like to add after this, listening to Dr. Mossey and Dr. Daisy?
Yeah, and listening to people, it always gives me a lot of inspiration. I think one thing to add is actually families and children are recipients, and often they feel like they're always waiting for another moment of care. But oral health is one thing they're so powerful in. It's something they do, and they are actually starting a foundation for speech, for everything throughout their whole lives. So we really need to stress that out as providers, that oral health, we need them to have good oral health, to have good surgical outcomes, to have a good quality of life for everything. And it's something that's so powerful, giving them that power and not being reliant on us. So I think something we should stress out, and education. It starts with education and prevention. If there's one thing we can prevent, is oral health diseases. And oral health diseases, it can cause a lot of harm for our outcome in the future as well, definitely for children with a cleft.
Correct. Beautiful. And also like knowing that if we provide the right resources and the right tools, they can actually take ownership of their own oral health, like not relying on someone else to do it for them, but just knowing that they have the capacity and power to create their own scenario. So Dr. Peter Mossey, there is a question for you in the chat. It says, how can the global cleft community better raise their voice and priorities within these broader global advocacy agendas? How do you think this movement needs to evolve and grow? It's a question from Sarah Horn.
Yeah, brilliant question. And there's one response to that I think is really important. And number one, oral health is much bigger than as an issue than the problem of cleft lip and palate, which is regarded as 1 in 1,000 or 1 in 700 live births. But when we look at the non-communicable diseases agenda that's been adopted globally, we see that 50%, almost 50% of the world's population suffers from oral diseases, and the major one being dental decay. And that has persisted over decades, despite preventive efforts. And if we, as a group, advocate a system where we've actually used the term caries-free clefts. Clefts are a susceptible population. We have introduced the principle of proportionate universalism, that is, targeting those in greatest need. If we, through this special advocacy group, can prevent clefts, prevent caries in our cleft patients, then we have done a massive humanitarian and health-related favor to the rest of the world, because we've addressed the most prevalent non-communicable disease that's known to mankind. So it's greater than the combined prevalence of cardiovascular disease, diabetes, cancers, and respiratory disorders. So I feel that we're now in a very special position where we're addressing a problem that affects, is a global problem, and that we are making progress in doing it through our interest in a marginalized group. And the wonderful thing I also think about cleft care is we have a very committed teams all over the world to look after these. So we have a chance of doing this because we're targeting our efforts into a particular group. So I'm really optimistic that through cleft care, comprehensive cleft care, we can address a much bigger problem.
I absolutely agree, and I join you with that emotion about, I think that if someone in this world is in a good position to actually achieve prevention, it's us, because we get to see the patients since they are babies. We get to see them before a tooth is erupted. So prevention can actually be applied there. Usually patients go to the dentist whenever something is wrong. If there's a pain, if there's cavities, and usually until the problem is installed. But we are in a place where we can make this happen. So let's keep hoping to have the next generation cavity-free. Thank you, Dr. Mossey. And Dr. Daisy, there is another question I would like to direct to you. So what are the most common oral health challenges cleft-affected patients face across their lifetime?
Yes, well, as dentists and pediatric dentists especially, that we begin seeing babies, we see a lot of dental problems, especially a high risk of early childhood. And sometimes this has to be with feeding practices. We also can see dental anomalies like missing teeth, extra teeth. This also, it doesn't help the hygiene. Malocclusions such as crossbite, crowding, maxillary constriction. In general, there are oral hygiene challenges, but the message that we all want to say today and we want to send is that we can talk about different kinds of treatments for all these problems and address all these problems. But instead of only focusing on treatment, what Maltrains and the toolkit propose, it's something different. It's about education, practical guidance, and awareness. All these issues, all these problems can be centered in one key concept that, again, I must have to say is prevention.
Thank you so much, Dr. Daisy. Dr. Bika, I would like to ask you something else. What advice would you like to give parents on this oral health journey? What is the advice you can provide?
Toothbrushing and nutrition. I think nutrition is something very crucial. And I think for oral health, we always think about toothbrushing, but nutrition as well. And I know in some countries it's very common to drink more sodas, etc. And what I also would like to stress out that a lot of parents still feel guilty because they have a child born with a cleft. So some of them will spoil their children, but it's not doing anything good. It's actually causing harm. So giving them the tools like the toolkit, education, like what is healthy nutrition, but also for us to understand their barriers. What are they struggling with? Ask open-ended questions to the parents and listen and try to find a solution, try to find new ways. It's not everything is accessible for everyone. For someone who has $1 to live the whole week with, a toothpaste and toothbrush can be very expensive, and even food. So we can't just think everyone has everything in low, middle resource countries. So we have to be creative, but we have to know what those barriers are. But oral health holds real power for parents. Otherwise they always need doctors, surgeons. But with oral health, they can actually set the foundation. And I think how we phrase it to parents, it can make a huge deal, and it can give them the real power to change the lives of their children. And oral health, it's for every child who has a cleft, who doesn't have a cleft. So it's not different for any child. So it doesn't set them apart from care. Yeah.
So wonderful, Dr. Vicky. And I think that there is something important there, because when you provide information to the parents, it's not only about like unilateral communication. It's not just you giving the information, but making sure that that information is well received. How do we know that they are actually, acquiring all this knowledge? As a parent, you always want to do the best for your kids. And if these things still happen, it's because probably they don't know better. And this is where we need to action. We need to provide the right information, the right tools, the right way, the right awareness for them to do all these changes. And as you said, like things so easy like nutrition, what they do like their daily basis, they probably have other options, like healthier foods or avoid the refined sugars and things like that. So just having the right information, it would make a huge difference. So thank you, Dr. Vic, for that. There is another question for you, Dr. Mossey. What recommendations do you have for health practitioners in low resources settings like Uganda who promote better uptake of oral health among cleft patients?
Yeah, and again, I'd really like to compliment Charity Aber for bringing this up, because it was another issue that I wanted to kind of highlight, and that is that cleft and oral health and clefts is not typically included in undergraduate clinical training programs, and I think that's missing. But I would like to ask Charity if they've heard of the Maldent project. Now, the Maldent project is the building of a new dental school and new dental curriculum in Malawi. So Malawi did not have dentists. Malawi did not have a dental school. And Malawi has now, in the last 12 months, produced its first cohort of new graduates. Now, they have been taught on a curriculum that's completely different from the conventional curriculum. And it's all about prevention. It's a prevention-orientated curriculum, which switches the emphasis from invasive treatments to preventive treatments. And one of the things that they're very strong on is the motivational interviewing and health coaching aspects of prevention, behavior change. And it's something that I think is missing from dental and medical curricula around the world. They talk about and are taught about pathogenesis, that is, the origins of disease. They do not are not aware of salutogenesis, which is the origins of health. What they should be concerned about is a health-orientated curriculum. So what they do in terms of prevention of dental decay, they're taught that a very simple solution exists through toothbrushes. And I know that Bika has just said toothbrushes are expensive to the individual in low resource settings, and so they are, because if you have a choice between a toothbrush and a meal, you will take the meal. But toothbrushes are cheap to the government. Toothbrushes could be supplied en masse and save millions. The health economics of prevention are undeniable. So what we have in Malawi and other, that's now been rolled into hopefully other low resource settings such as Uganda, is a preventive orientated curriculum, because they know that the solutions to dental health and dental care and dental disease in low income settings is not through a dental drill. It'll be through community prevention and population prevention initiatives.
Thank you, Dr. Mossey. And I think that just to be able to approach the governments, as you mentioned before, it's important that we collect data. So when it gets measured, gets action, as you say. So with all that information, we will actually be able to do some policy changes and approach to government for all these efforts that could really make a difference. So Dr. Daisy, there is a question for you also. As a clinician who works so closely with families, how do you ensure families don't become overwhelmed with cleft care information? This is from Derek.
Well, that's a very interesting and very important question. And what I've learned during all this time is that sometimes you don't need to tell all the information to the family at once. Care cleft can be overwhelming, of course, and I think that we should be relevant step by step and give the right information at the stage of the child's journey. This is using a simple and a clear language. I also think that we have to listen to parents. Sometimes we want to share a lot of information, and sometimes they're not even asking what we are ready to say. So the first thing is always listen and create a space with confidence where they can have or give you more questions, and they feel free to ask the questions. I think that finally we have to remind that they're not alone. That cleft care is a journey, and we walk together step by step. This is my message.
Thank you, Dr. Daisy. Important to remember that this is patient-centered. So we need to listen. We need to actively listen and provide what is needed for the families and caregivers. Thank you so much. And one last message. Thank you all for sharing your insights and expertise. Dr. Bika, as someone with lived experience and now works in cleft care, is there anything you would like to see from an NGO like Small Train when it comes to ensuring representation and inclusion of people born with clefts in these discussions?
Yes, I think you're actually setting the bar for all the other organizations. So I will applaud you. It's huge what you're doing, and you're really working towards comprehensive cleft care, which is needed everywhere. For people with lived experience, it's lovely to have them sometimes in discussions as well, like just to know you learn so much from experiences and from experiences globally. And it's something that can be integrated. You see also meetings shifting and having people having panel discussions, but having them center on the front row as well, not always in the back, not see them just as a patient, but there are advocates and they can help to shape care, how we should actually move forward. And they are essential and they are not bystanders. We need them as well.
Thank you so much, Dr. Bika. Anything else that any of the panelists would like to share? So before we wrap up this beautiful session, Dr. Mossey?
Well, I think we bear in mind just what Dr. Bika has just said, that the optimal outcome of cleft care is a well-adjusted, happy, healthy person who can achieve their full potential. And we see that now as being a very significant aspect of this agenda. The recent conference we had in Kyoto had some of these organizations heavily represented and having a massive influence on the dialogue of how we should be achieving that and putting more resource into that. And, oral health is a massively undervalued component of that. Having a healthy mouth, a healthy body, and a nice smile for the psychosocial and confidence aspects of your life and your potential to live a normal life.
Thank you so much. And I just want to thank you all for your time, for sharing your insights. I think it's very important that we have different perspectives. As everything in life, we need to see it from different angles just to get a full picture and see how we want to move forward with confidence on this. And I want to thank everyone here in the audience for taking the time to learn about this topic that has gained, as I said before, it is gaining more attention, and like doing small things like low cost efforts can really take us into the next step. So we will be sharing also different resources through the email. And I also want to invite you to join us to our global campaign that is going to happen tomorrow on our social media for World Oral Health Day, which is actually March 20th. More information will be coming to you guys to see how you can be involved, to join, just to keep spreading the word and just keep talking about oral health. As Dr. Vicky mentioned, oral health is every day, but we have a very great excuse tomorrow to be talking more about it and just keep getting more people on board. So thank you all for your time for this beautiful session. This will be recorded and also will be available in the future for everyone. Thank you so much, and I'll see you around.